President William Ruto chased out of Finland after Rigathi Gashagua's prophecy comes true. Ladies and gentlemen, welcome again to Kenya Lens Media, where we bring in news updates as they break, and kindly, if you are new here, consider subscribing. Now, the former Deputy President Rigathi Gachagua is warning that the Social Health Authority (SHA) is showing signs of collapse, but the government insists the system remains stable, funded and fully operational. But according to relatable sources, it's now 4 days that SHA is not working. And remember, it is something that Rigathi Gachagua had prophesied some few months ago, and now that is a prophecy come true. And it's something that is troubling President William Ruto so much in Finland. The future of Kenya's healthcare financing system has once again become the center of the national debate. The former Deputy President Rigathi Gachagua has raised alarm over the performance of the Social Health Authority, commonly known as SHA, claiming that recent system disruptions are evidence that the country's new health insurance model is nearing its collapse. Speaking during a United Alternative Government press briefing on June 10, 2026, Gashagua pointed to reports of system outages that he said had affected operations for several days. According to the former Deputy President, the interruptions are a warning sign of deeper challenges within the system. His remarks add to the growing public discussion surrounding the implementation of the SHA program, a program introduced to transform healthcare financing and also expand access to medical services for millions of Kenyans. The concerns raised by Gashagua focus largely on the financial relationship between the authority and the healthcare providers across the country. For months, he has maintained that delays in payments to hospitals could place significant pressure on service delivery. He argues that outstanding bills owed to health facilities, particularly private and faith-based institutions, are creating uncertainty within the healthcare sector. According to his assessment, some facilities are facing substantial financial strain due to the delayed reimbursements, and the former Deputy President warns that if such challenges continue unresolved, some hospitals could find it increasingly difficult to sustain operations and provide services at current levels. His comments touch on the issue that directly affects ordinary citizens, and for millions of Kenyans, healthcare is not an abstract policy discussion. It is the ability to receive treatment when sick. It is access to medicine when needed. It is the assurance that hospitals can continue operating efficiently and without interruption. Any concerns surrounding the country's healthcare financing system therefore attract significant public attention. The debate comes at a time when many Kenyans are still adjusting to the transition from previous health insurance arrangements to the new SHA framework. The authority was established as part of the broader healthcare reforms aimed at expanding universal health coverage and also improving access to medical services. Supporters of the reforms argue that the challenges are intended to create a more sustainable and also inclusive healthcare system. Critics, however, continue to question whether implementation challenges could undermine those goals. And despite the concerns raised by Gashagua, the government has strongly rejected claims that SHA is at risk of collapse. Healthcare Cabinet Secretary Aden Duale has dismissed the allegation, describing them as inconsistent with available data and performance indicators recorded since the authority became operational. According to the Ministry of Health, SHA has now been in operation for approximately 19 months, and during that period, the government says the system has continued to expand both in membership and also in financial activity. The ministry reports that more than 30 million Kenyans have already registered under the SHA, or the Social Health Authority. Officials also say new registrations continue to be recorded daily, reflecting ongoing public participation in the program. The government maintains that these figures demonstrate confidence in the system and also its ability to deliver healthcare services across the country. In defending the authority, the Minister of Health has highlighted several financial indicators intended to show the scale of resources flowing through the system. According to Cabinet Secretary Duale, health facilities across the country have received significant funding through the Social Health Insurance Fund, and the government reports that under the SHIFT program alone, healthcare providers have received approximately 97 billion shillings. Officials say these funds have supported treatment, hospital operations, and also healthcare delivery for millions of beneficiaries. The government has also outlined additional allocations made to strengthen different areas of healthcare provision. Civil servant and teacher medical schemes have received a combined allocation of 3.5 billion shillings. And according to 1.4 billion shillings has been directed towards emergency care, chronic disease management, and also treatment of critical illness. And these categories often involve some of the most vulnerable patients within the healthcare system. For families dealing with long-term illness, emergency medical conditions, or life-threatening diseases, such funding can play a critical role in ensuring continuity of care. The government has further indicated that 19 billion shillings has been allocated directly to primary healthcare services. Primary healthcare remains one of the most important pillars of any health system, and it represents the first point of contact between citizens and also medical services. It includes routine consultations, preventive care, maternal health services, immunization programs, and also treatment for common illness. Health officials argue that investment at this level strengthens the broader healthcare system by reducing pressure on referral hospitals and improving access to care closer to communities. Based on these figures, the Minister of Health insists that SHA remains operational and also financially active, and the government officials say the available evidence points to a functioning system that continues to collect contributions, register members, and also make payments to healthcare providers. The disagreement between the opposition and the government highlights the broader challenge of managing large-scale healthcare reforms. Transforming a national healthcare financing model is often a complex process involving technology system and financial management, service providers, and millions of beneficiaries. Even minor disruptions can quickly attract public concern because healthcare affects nearly every household. And at the same time, government officials emphasize that large systems occasionally experience technical difficulties without necessarily indicating structural failure. The discussion surrounding SHA therefore extends beyond politics. It touches on issues of public trust, service delivery, financial accountability, and access to healthcare. For patients seeking treatment, what matters most is whether hospitals remain able to provide care when needed. And for healthcare providers, reliability of funding remains essential for maintaining operations, purchasing supplies, paying staff, and also serving the community. And for policymakers, the challenge remains balancing ambitious healthcare reforms with effective implementation on the ground. As debate continues, both supporters and the critics of the system agree on one fundamental point, that the healthcare of the nation depends on the strength and the reliability of its healthcare infrastructure. The coming months are likely to see continued scrutiny of SHA's performance as stakeholders monitor service delivery, financial flows, and also the experiences of patients across the country. For now, the country is presented with the sharply different narratives. One side sees warning signs that demand urgent attention, the other points to billions of shillings in allocations, millions of registered members, and ongoing payments as evidence of stability. What remains certain is that healthcare remains one of the most important issues affecting the daily lives of Kenyans, and any questions surrounding its future will continue to command national attention. In the end, beyond the politics and the competing claims, the true measure of any health system is simple: whether every Kenyan can access timely, affordable, and also reliable care when it matters most. That is all for today from Kenya Lens Media, where we bring you news updates as they break. And if you're new here, consider subscribing, liking, and sharing our content. Hit the notification bell so that you can be receiving notifications each and every time we bring you a new content.